and then shared with all the attendees at the end. So in case you miss anything, um, don't worry about it. I have nothing to disclose. A lot of what I do is off-label. This is really an educational presentation and opinion only. Briefly about me, I grew up in the Chicago area, undergraduate, Northwestern, and medical school, University of Illinois, and then did my head and neck training and facial plastic surgery fellowship at Mount Sinai in New York. Then came here to Washington, D.C., and we've been here in the D.C. area practicing for about 14, 15 years, and we're just walking distance from downtown. This is our team here at Potomac Plastic Surgery. You'll see and meet them when you come visit the office, and they're a big part of what makes us special. While we do a lot of things in the face, like Botox and so forth, we're going to really focus on the lower 2/3 and sculpting. And sculpting really means adding and reducing volume. You know, for example, this patient from before and after, before is on the left side of the screen, after is on the right. We want patients to look a better version of themselves and not a different person. Patients often are coming to us with various concerns of feeling tired, low energy. They complain of a double chin, they may say they have chubby cheeks, they feel too fat, whereas in fact, it may not be excess fat. And as a facial plastic surgeon, I'm always thinking about anatomy when a patient comes into the office, whether it's laxity or looseness of skin and muscle or structure. A lot of issues with the chin and neck have to do with structure of bone and fat, and not necessarily your weight, it's just how your face developed over time. Keep in mind, while surgery is permanent to a certain degree, your face and neck continue to change over time. We develop laxity or looseness in the skin. Think of the skin as pizza dough. It kind of stretches slowly over time. And these areas in pink are the areas that typically start to show the first loosening. But we also gain and lose volume in the face and neck over time. On the left of the screen is areas in shaded blue where we lose volume. Think of starting from a grape, going into more like a raisin as we get older. Whereas the picture on the right shows in yellow areas that we gain fat. Despite a healthy diet and exercise, we gain fat under our chin and our jowls with time. And we look at everything. And this is an example of a patient with a weak chin, a double chin, but has many structural issues with the bone, the fat, loose skin, but also loose glands. We can't treat everything in the neck. I avoid treating the glands directly. Next slide. In our mind, we like this, of course, right? But again, we work with what we have to have an improved version of yourself. So you look, when you go back to your family dinner, that you have more energy, that you don't look different, you just look healthier. Treating fat, there's a lot of non-surgical devices and Kybella. We offer that here, but the gold standard still is liposuction for the superficial fat. I call it a 3-stitch neck lift because it's 1 stitch underneath the chin, 1 stitch behind each earlobe. Or if it's a deep fat issue in the neck, then you really need like a deep neck lift to address that. This is a side view. If you look in white, this is the fat in the neck, and there's a little line of muscle that separates the deep neck fat and the superficial neck fat. But by and large, most patients have a superficial neck fat problem where liposuction addresses. Here is an example of Kybella. The ideal patient for non-surgical fat reduction in the neck are those that don't have a lot of fat. They're generally young, they have good bone structure, good skin tone, and these non-surgical options do require multiple treatments. It's not just one and done. It's one, you come back in a month, do another, come back in a month, do another. So it's really over time. But by and far, a lot of patients who come and see us do benefit from liposuction. It's one downtime, one procedure, minimal discomfort, and patients often go back to work right away. But the other added benefit of liposuction versus the other non-surgical options is it really helps sculpt the entire jawline. because we're not just liposuctioning directly under the chin, we're treating the entire neck and jawline area and jowl area to create definition. Even for patients who have a laxity issue, this is a patient who needs a facelift or neck lift, but just didn't have time at that moment in her life. So we did liposuction, and she has skin tightening that occurs a few months after the procedure itself. Well, what if you have excess cheek fat? And this is a very common problem. Here's an example before, and this is a very minor procedure. We make a small incision inside the mouth and reduce fat that you really can't exercise away or diet away. This is something that you were born with. And often patients who have a weak chin or double chin often also complain of chubby cheeks, even since childhood. And we can add this to help better define the jowls, the mid-face area. Well, what about bone? Bone can be augmented or enhanced with fillers, chin implant, or jawbone surgery. And what are the risk factors? Well, as I alluded to before, if you've had a long orthodontic history or dental history, a lot of braces growing up, wisdom teeth extraction, grind your teeth, you are more likely than not have a relatively weak chin bone, and you're predisposed to having a double chin or ill-defined jawline. Here's an example of a patient who wasn't ready for surgery, but we did fillers. We added fillers in the chin. And if you notice, we improved his chin, but his neck improved as well. We did nothing in this patient to his neck. But most patients would benefit from a chin implant. Chin implant, I use an implant made out of silicone. Here it is in blue. The actual implants are clear, and it's placed right along the bone, along the entire jawline. Here's a patient before and after of a chin implant. She also had cheek implants. Her neck and jawline improved. I didn't do any liposuction in her. It's just chin augmentation itself. Many patients do get lipo with a chin implant. Again, if your specific anatomy dictates it, we'll make recommendations one way or another. And this is the patient from before. She had liposuction to reduce the neck fat, but also tighten the skin, and chin augmentation to further create better definition and contour. And here's some other examples. There's just a couple stitches below the chin, a couple stitch behind each earlobe for better improvement. And this is just a few days, about a week after. So there is bruising and swelling, but it's generally minimal. Patients could wear makeup, they go to work. It's just we avoid exercise for the first week after surgery. But what about the jaw muscle? Again, it's a common issue. This is all interrelated. Cheek fat, neck fat, weak chin bone, large jaw muscles. Think about it this way. If you're grinding your jaw, tensing your jaw, what do muscles do when they're under tension? They grow. Here's an example of before and after. Here we treat primarily non-surgically with injections. We relax the muscle with treatments such as Botox, Dysport, Jeaveau. These are all brand names, but they all do similar things to relax the muscle. And then over time, the muscle shapes, your face becomes less wide. You look, quote unquote, less fat, but in these patients, it's really not fat, it's muscle that we're shrinking over time. Here's another example. And these patients often have had wisdom teeth extraction. They see their dentist often. They may complain of migraines. And then there's always patients with laxity. They have loose skin in their neck and face. And liposuction alone or chin augmentation alone or these other procedures alone won't do it. You really have to lift, tighten, and remove skin. Usually patients are over 40 when we start to think about this. But these are examples where patients have had loose skin and we've removed the skin. We've also done lipo. It's very common in the facelift, neck lift patients to do liposuction in addition to removing face and neck tissue. So what's the best procedure? At the end of the day, it comes to an individual anatomy, their circumstances, where they are in their life, and their preferences, and really takes an office consultation at some point to determine what's best. And here are some examples of before and after where patients have had multiple procedures because they needed and wanted better definition of their entire neck and jawline. This patient had cheek fat reduction, neck liposuction, as well as chin implant. There's a small incision underneath his chin. This is also a very common issue for men, and one stitch behind each earlobe. This is a patient who had a lot of anatomic issues. She has excess neck fat, loose skin and muscle, weak chin bone. So we did pretty much everything: facelift, neck lift, liposuction, chin augmentation with implant. Thank you. So now, Janet, we will open it up.
I am back.
You're back. Great.
We had some great questions that were sent over. I'd like to start with one that was fat taken from the neck area. Can it be used as fat transfer?
Good question. The fat that we take out in neck liposuction is really not a lot. And the fat that we add in the face and the cheeks, or the under of the eyes, or the lips, usually we take from the abdomen, the hips, thighs. So no, there's not enough fat here to inject anywhere else. However, if I remove cheek fat, buccal fat, yes, there's enough fat in there that's of good quality where I could put. But for those patients who want fat transfer here, usually we'll still need more anyway, and we'll take it from their abdomen or thighs.
Does the surgery require general anesthesia?
Again, it's really patient dependent. A lot of procedures we do can be under local with sedation. So think of it as twilight anesthesia. However, in the era of COVID, it is safer for the anesthesia and the nursing staff to have general anesthesia in terms of COVID protection. However, each case is a case-by-case decision, and patients are involved with that decision as well.
What's the recovery time like on any of these procedures?
Well, you know, if you look, we showed one example, but there are other examples. If you look on our website under the blog, under downtime after plastic surgery, you'll see other examples, whether it's eyelid surgery, facelift surgery, neck lift surgery, chin implant, so forth, what they look like after a week. And quite honestly, patients are often pretty presentable. Again, individual cases will vary, but most patients are back to work about a week, sometimes 2 weeks. You know, it really depends on each person.
What do you look like when you come out of surgery?
Well, you're going to be a little swollen. You're going to be a little puffy. It depends on the procedure. So if it's cheek fat reduction, you may look a little puffy. You may or may not have any bruising. There's no bandage. If it's just lipo, there's one stitch here, one stitch behind each earlobe, and you have a little dressing, kind of a support that you wear. That's about it. If there's a chin implant, there's tape around your neck, a little puffiness here. So generally not a lot of bruising and swelling, unless, you know, those who generally swell more are men because of the facial hair. But even then, it's usually has not been a major concern. And most of the bruising and swelling goes away in about a week to 2 weeks.
Does any of the profile sculpting affect any function after you have the surgery?
Well, for the first couple of days, we ask patients not to chew hard foods. And that's just so they don't, you know, bite their cheek or stretch too much. But long-term, no. Patients go back to a regular diet after the first few days. They go back to exercise after about a week to 2 weeks. If they need to go back to their dentist, what they often do, because they have dental issues to start with, usually we'll wait a few weeks. We'll recommend waiting a few weeks before they go back and do any dental procedures.
Is there any of these procedures or any procedure we haven't discussed that would help to make a bigger smile, like to show more teeth, to open the mouth area up?
Well, we have seen patients who have very tight muscles around the lips and the chin. So if they're really struggling, really stretching that, we would loosen or relax the muscles temporarily with things like Botox. Or if they feel like they're too thin in their lips, and that may be an issue, that's treated with fillers. Again, these are non-surgical options. For those who have a long upper lip, either congenitally or develops with age, we get loose skin here, excess skin here. We also get long skin in our upper lip. That's a minor procedure. It's called a lip lift, where we remove a little bit of skin here. That can be done in the office under strictly local anesthesia. You're awake and comfortable, and that will help show the teeth.
When is the best time to have a procedure done?
Well, now with COVID, really, you can do it anytime. You're wearing a mask. You're hiding your recovery, right? Again, it's an individual decision. When your work and social calendar allow some recovery, most patients plan for at least a few days off. But quite honestly, you could go back to work the next day or day after if you wanted to. You know, whether it's with Zoom or if your office demands you go back physically to the office. But plan at least a couple days off, and you could do this. We do surgery all the time, and any season there is no best time per se.
Does loosening the skin when you do, or do you get loose skin when you do the muscle relaxing around the mouth area, or when you do fillers? Does it cause any skin laxicity in the future?
We haven't seen that. That's a good question. We haven't seen that. So the only time where loose skin or making more loose skin becomes an issue is if you are a facelift or neck lift candidate to begin with, if you have loose skin to begin with. So patients who are over 40 who complain of issues around their lower face, and if you just do lipo or if you just do one thing and not address the loose skin, they may feel like they have more loose skin afterward. But those who are younger, who have excess neck fat or a weak chin bone or tight muscles around the mouth or tight jaw muscles, if we do any non-surgical treatment, Botox or fillers or chin implant, loose skin has not been an issue. Keep in mind that even after liposuction alone, there is some skin tightening. So we've had patients who are facelift candidates. They get the lipo, they're not ready for a full facelift. They get the lipo, and there's some skin tightening that occurs. So again, we generally haven't seen looser skin after any treatment, but theoretically it can happen.
Is there anything that you should do before having a service like this, or that you should prepare for before having a surgery like this?
Good question. Most patients, they really should have a generally healthy, most of our patients we see have a generally healthy lifestyle. So that means no smoking, drink plenty of water, eat your fruits and vegetables and plants, avoid refined foods or heavily processed foods. Those are the most important things prior to surgery. And then, we have an outline what else to do, things like avoiding certain herbs or supplements that can thin the blood prior to surgery and after surgery. And now with COVID, we asked all patients to be, isolated for at least 2 weeks before and 2 weeks after, because we don't want you to bring COVID to us. We don't want you to catch COVID in recovery after surgery. And we've been doing surgeries many months now safely. But those are some of the main things.
Do you know of any long-term side effects from getting Botox or fillers near the chin or lip area?
We haven't seen long-term problems, but keep in mind Botox and these Botox, Dysport, Jeaveau, these are called relaxers. They're temporary. They last about 3 months, and then your body kind of recovers after it. But Fillers last anywhere from, fillers are gels that are added to the chin or jawline. Your body, it's a gel. As soon as we inject, your body dissolves it over time. Fillers, however, can have issues with lumps, bumps, nodules, irregularities. We haven't seen it here. We have treated those issues when they've had it injected elsewhere. Fillers last 6 months to a year. And what's nice about fillers, we have a method to dissolve them if an issue occurred.
Can you just do one of these procedures at a time, or do they all have to be bundled together if you needed more than one?
Good question. You know, quite honestly, again, it's an individual case by case matter. So when a patient comes in to see me, and if they want to talk about their options for the lower face and neck, it really depends what their main interest is. And anatomically, if they're primarily a fat issue or bone issue or skin issue, I'll advise them on such. Now, I'll kind of prioritize your number 1, 2, 3 option in priority. So no, you don't have to do everything at once, and you could kind of pick and choose. So for example, often patients will choose chin implant, neck liposuction at the same time. They may have excess fat here, but we'll say, okay, let's hold off on the cheek fat reduction, do the neck lipo and chin implant, and then reassess. Or alternatively, they may say, I have a lot of fat here, I've been chubby all my life, and I hit the gym every day. What can you do for me? Well, I say, well, why don't we start without surgery and relax the jaw muscle, and then reassess if you still feel fat. And then if it's still an issue, then do cheek fat reduction. So no, you don't have to do everything right all at once. You know, it's a conversation we have with patients.
Can you go over the mini facelift, and is that something that's done in the office or is it in the hospital? And is it comparable to a full facelift cost, or is it less money?
So mini facelift is not a distinct term, but generally speaking, all facelifts or neck lifts involve incision around in front and behind the ear, where we loosen the skin, tighten the muscle, and then remove a little bit of excess skin. So whether it's a mini lift, deep plane facelift, mass lift, S lift, call it whatever you want, they all generally involve similar kind of maneuvers. All that being said, they treat the skin and muscle laxity primarily. They don't treat bone structure. They don't treat excess fat that you may have in the cheeks or the neck. So often neck fat or buccal fat needs to be addressed at that time. We don't do those procedures in the office here. There's 2 facilities within walking distance. They're not at the main hospital, but they're at surgical centers. So it's sterile. Everyone's tested for COVID nowadays right before surgery, and the staff there, you know, no one's allowed with fever and so forth. Everybody's screened, including myself, before we go to the facility. But we don't do that in the office. The only procedures we do in the office that are strictly awake, local anesthesia. So upper eyelid, left, all the injections, those sorts of things.
After you get a filler in the chin area or around the mouth area, when can you do a laser treatment?
You could wait a few days. And generally speaking, after any kind of injection, whether it's filler or Botox, we generally say wait 2 weeks. 2 weeks is kind of a good, kind of safe. Longer is always safer, but 2 weeks is a good starting point.
Is the chin implant that you put in, is it actually blue?
No.
Is that a safe implant?
I'll show you. Here. I have some implants here. These are models. So when patients come in, we kind of size them, get an idea which implant would be ideal for them, size, shape, so forth. The actual implants are clear. And so what's nice, because it's silicone, it creates more definition than fillers in the chin. because if you can keep injecting fillers, the chin starts to lose definition. So again, we have that conversation with patients, but the actual implants are no, clear. We have a few more minutes, Janet. I just want to keep everyone on time.
Sure. We have one last question that's coming in. If anyone has anything last minute, feel free to send it over to me. But how long does chin filler or the jaw relaxer last?
So fillers around the chin, 6 months to a year. It's like ice. We inject and your body slowly dissolves it over time. Okay. Relaxers here in the jaw, 4 to 6 months. When we give Botox or Dysport here, usually it's 3 to 4 months. Here it lasts longer because it's not just for movement, it's to shrink the muscle, make it a little narrower, less masculine and more feminine, less fat per se, and just better defined. So about 4 to 6 months here, 6 to 12 months here.
Great. Well, I think we're ready to wrap up.
All right. Well, thank you everyone for showing up, and I hope we answered most of your questions. And Janet and I are available if you want to email more questions that come up or want to schedule a video or in-person consultation. Please, everyone, stay safe during this pandemic time, and we'll keep in touch. Thank you.
I wanted to say one more thing. Everyone's invited to our next one. We're going to have fat transfer versus fillers so that you can learn the difference on those and see if one's right for you. And that's going to be coming up in March. So look out for that in our newsletter. Thank you, everyone.
Thank you. Bye-bye.
Bye.
Seema, did you have a question?